everyone. My name is Manu, Kalia. I'm a physical therapist and Ayurveda herbalist. And I'm here with my friend and colleague Eric. Eric is a physical therapist also. And today we're going to show you a hip flexor stretch. Your hip flexors are a group of muscles that are in the front of your thigh. So it's your iliopsoas muscle as well as your rectus femoris. And so tightness in this group of muscles can cause a lot of problems, and quite often low back issues, sacroiliac or SI joint problems, hip issues, and even further down because it changes the mechanics and the chain. So your knee, your ankle, your foot. So you can have a lot of issues with that. And since most of us sit so much, we quite often get a lot of stiffness and tightness in a lot of these groups. So I want to show you a simple stretch that you can do to open up your hip flexors and stretch that group out. So we're going to use a chair because I think it's an easier way of doing that. As long as your knee is okay and putting pressure on your lower leg or knee does not cause problems, this method can be used. So a chair with the back is ideal because you can hold that to balance yourself. So I'm going to try to stretch my left hip flexor. Okay. So I'm going to put my knee's going to go on the chair, my left knee and my lower leg. I hold on to the back. And my front leg, I keep out here with a slight bend in my knee, my right knee. Now, as soon as I get in this position, I'm going to get some stretching in this group. You might even get some in your quads through here too, but we're targeting this group right in here. You want to make sure you don't arch your back too much when you're doing that stretch, because that's going to get in the low back, right? Or you don't want to lean too far forward because then you're not going to get the stretch. So you want to stay upright in that position. Okay, if I want to get a stronger stretch, all I do is I shift my weight forward. So I bend the front knee and I lean forward. Now when I shift it forward, I get a stretch right through here. But my back is relatively straight. Okay, if I want a slightly stronger stretch and also to take some of the pressure off my back, you want to tighten your butt or your glutes on the side you're stretching. So when I tighten those guys, I'm going to get a stronger pull through here, because your glutes or your butt muscles are the antagonist or the opposite muscle group to your hip flexors. So when I tighten these guys, it causes my hip to go into slight bit of extension or going backwards, and it will stretch more of my hip flexors too. Okay? So which will really help open up the front of the hip, stretch out your hip flexors and even your quad. So and it'll take a lot of pressure off quite often with the back and a lot of other things too. Alright? So if it's difficult for you to put your leg down or knee on a chair, you can always use a pillow too. Put a pillow, put the leg on that, and be a little bit more comfortable. But you got to make sure, depending on your height, how high the chair should be. Because if the chair is too high, your hip is going to be up. You're not going to be comfortable in that position. If it's too low, you're going to have to bring the front leg further out. So you bring your body down a little bit more to maintain the alignment. Okay, so you have to play around with it a little bit. So, but make sure if you have any ongoing low back problems, hip problems, sacroiliac joint problems, knee or any other issues going on, you get yourself cleared off or checked off or assessed by your physical therapist or physician before you try some of these stretches. Okay? I hope you found this helpful. Please leave a comment and subscribe to the channel because I want to hear from everybody. And thank you again.